Now, raw garlic is the king.
Yes.
13 times more effective.
Raw garlic, y'all.
Raw garlic, bad breath. Look out. Look here, as I say, a little bit of BO and bad breath. So what? It's good for your health. You have to live with. Get you some peppermints.
But there is nothing worse than that garlic smell on people's pores. But hey, take a shower. Hey, what's up, everybody? Welcome to a special Brewer Report. As you can see, me and my father are together. We are in our, guess you would call it our house studio. This is the home that I grew up in, and it's great to be together so we can really have just a full out conversation with today's topic. Now, today's topic will be all about onions. You hear us talk a lot about Dr. Fuhrman and his acronym G-BOMBs. So onions is a part of that acronym because you have greens, beans, onions, mushrooms, berries, and seeds. So we're going to do a deep dive into onions and garlic. And as usual, my dad will take it away where he'll get into the science of the onions and garlic. Again, just give you a really good deep dive into it. So first we're going to start with the cardiovascular, how onions and garlic help with your cardiovascular system, right?
Yeah, absolutely. What they found is that raw onions and garlic, especially, basically what happened. Let me start with this. I'm a septuagenarian. I will soon be an octogenarian, which means I'm going towards my age. As you age, your arteries stiffen. Okay, that's natural. So what you want to do is age gracefully. So you want to eat foods that basically help you to age gracefully, and garlic helps with that.
Right. So that's the key, real quick. When you age, your arteries are just going to automatically stiffen. It's not just about what you're eating, because oftentimes you hear people say, "Oh, don't clog your arteries based off of your diet." But again, it's as you age. So that's why, as my dad has said, why we're doing this Brewer Report to really educate you on the proper foods to, as my dad says, to age gracefully. So I'm sorry.
Right. So in order to keep your arteries from stiffening, what the stiffening occurs in the lining of your arteries. Okay. So what garlic does is garlic basically loosens that up. In other words, so that it doesn't stiffen. It has a protective mechanism against cardiovascular disease. And so it's anti-clotting. I'm gonna read now. Anti-clotting, cholesterol lowering, antioxidant at blood pressure, etc. In fact, it works so well. Like, think about clotting. What would you be concerned about with clotting? If you're on blood thinners, if you're going to eat garlic, you have to be a little bit careful.
Yes, or if you're about to have surgery.
Right. In
Yeah.
fact, the anesthesiologists say that you should wait at least 7 days before you should stop eating your garlic and your onions at least 7 days before surgery.
Right.
Okay. Now, raw garlic is the king.
Yes.
13 times more effective.
Raw garlic, y'all.
Raw garlic, bad breath. Look out. Look here, as I say, a little bit of BO and bad breath. So what? It's good for your health. You have to live with. Get you some peppermints.
But there is nothing worse than that garlic smell on people's pores. But hey, take a shower. Go ahead.
Now, here's the kicker. It's raw garlic.
Yeah.
Okay, it's raw garlic. So in order for the enzymes to work, it has to be raw. If you cook the garlic, then it kills the enzymes. So it kills the enzymatic effect. Now, a cooking tip. What you do is you crush the garlic and let it sit for 10 minutes. And then the enzymes come back. Now you can cook it a little bit.
Right.
Some people can't quite handle garlic raw.
Absolutely.
So you let it cook. Now, you can still get the full, now that gives some of the enzymes back.
Yeah.
But to get the full enzymes back, you add some garlic juice to it while you're cooking.
Gonna have some garlicky noodles, garlicky stir fry, garlicky chicken.
That's true.
Hey, but you'll be healthy.
Now,
Yeah.
onions actually shine with a little bit of osteoporosis. Okay. Okay. So what they found was that women over 50, a study, improved bone density by 5% and reduced risk of hip fracture by 20%. Now, let's not get it twisted. Onions are good for the osteoporosis, but the queen and the king of osteoporosis is prunes.
Okay, so flatulence. So so you'll have good bones and flatulence. Got it.
And you smell good. But there, garlic, but now,
No.
where garlic really, really shines
Yeah.
is in colds. And everybody knows this. Garlic, 60% pure colds and 70% faster recovery from your cold. That's where it really, really shines.
So you have the garlic that's helping your heart. You have the garlic that's helping you with colds. And then we're learning that there's a system to how you'll get the maximum benefits of garlic.
Right.
Have it chopped, have it sit for 10 minutes,
Right.
then you can cook it and keep some of
Right.
the benefits, or it definitely put some garlic juice to really get even more.
Right.
Okay,
Absolutely.
Yeah.
Absolutely. Now,
Yeah.
the studies on garlic are not quite as strong with cancer.
Yes.
Okay, there is some evidence that it can control cancer, but there are not enough clinical trials right now in terms of randomized control, placebo-controlled trials to show that garlic has an anti-cancer effect,
Which is important.
which is important. Now, one that does have cancer is the onions.
And Fuhrman is big with onions, by the way. We mentioned him at the top. He's really big with onions, but
Yeah, he's really big with onions.
go ahead.
Now, onions, red onions are the highest antioxidant, have the highest antioxidants. And remember what we always say, the antioxidants are in the pigment.
Yes.
Okay. So red has deeper pigment, followed by yellow, followed by white. Now, all of them are good, but that's how it works.
And you want to cut that red onion a certain way, correct? To maintain, almost similar to what we were talking about with peanuts before. You want to try to keep as much of the skin, which is where
Right. The
those
paper
benefits
wrap,
are.
they say a lot of people throw away. When they start peeling that onion, they take the paper shell off. That's fine. But when you take the paper shell off, that's it. Don't touch the rest of that onion because the antioxidant, most of the antioxidants in that outer layer of that onion.
Right.
Okay. That's where the outer layer is. Now,
All right. So what did this study say about?
okay, now Fuhrman is big on long-term studies. Okay, this is what Fuhrman said. I have to read it. Fuhrman said, based on an Advent Health studies are long-term and large populations. And Fuhrman says that eating 1/4 of an onion per day reduces the risk of stomach cancer by 54%, prostate cancer by 71%,
Mm.
uh, uh, esophageal cancer by 88%, ovarian cancer by 73%, and colon cancer by 58%. Now, this is based on an Advent Health study.
Let me load up on them onions then.
Yeah, they're gonna smell good.
But make me an onion burger.
And then there was a
Plant-based.
Asia Pacific Journal of Clinical Oncology study in 2019 that found that um, there was an 80% reduction, a lower risk of colon cancer.
Which is big.
Now, for some reason, Asians have a lot of colon cancer, so that's why they focused on that particular study. But the additional studies have found that onions may lower the risk of bladder cancer, brain cancer, breast cancer, lung cancer, ovarian cancer, and stomach cancer.
But there are some conflicts, correct? Because that's Furman's side. Because I do recall listening to Furman do a podcast where he was really emphasizing onions on salads, particularly for women when it comes to our esophagus, things like that. But Dr. Greger, you said, is not quite as convinced.
Now, Gregor of nutritionfacts.org,
Yeah.
he's a real randomized, triple-blind, controlled clinical trial guy. He said the only significant study he found was that onions, when you are going through chemotherapy, will ameliorate the high blood pressure, blood sugar and insulin resistance in breast cancer patients. That's what he found. But let's cut to the chase. If you're gonna eat, I'm gonna go with the sort of the large studies.
Right.
I'm not gonna give up my onions. I love onions anyway, and I love my garlic.
Love the taste.
Yeah, we love the taste.
Yeah.
And we'll deal with the BO and the bad breath. I'm sorry, we just have to deal with that. But
Sorry, y'all.
but that's where it rolls. Okay.
Yeah.
So, but when you look, the number one thing that kills Americans is cardiovascular disease, and it's quite clear that both of these will help you with cardiovascular.
Right, right. And so that's clear. It's clear that these are 2 healthy food items to add to your diet. Um, and when it comes to these studies, look, science can change. We're going to continue to learn more and more. Include it in your diet. You have the G bombs, you have, your greens, your beans, your onions, your mushrooms, your berries, your seeds. You can't go wrong with that. And, the big C is important. And I recognize, with these large studies, with years, it's hard to pinpoint whether it was just the onions, right, that helped
Right, right, because
prevent.
as we say, it's what you eat, not what you eat, it's what you absorb.
Right,
So if you're eating these foods in combination,
right.
because how we like our onions, how we like our garlic. So you eat them in combination. If you eat them with your tomatoes, if you eat them with your cruciferous vegetables, and you're putting, as you said, in your salsa,
Right. In fact, that I'm glad you mentioned that, because we talked at the top about how cooking garlic can sometimes take away some of the benefits. You can make a good pico de gallo and put some chopped garlic
right,
raw
right,
in there,
right.
so that would
That'll work. And
that'll
if
be
you,
lit.
like you said, like we said before,
Yeah,
if you want to cook it,
yeah.
leave it aside, chop it, leave it aside for 10 minutes, and then cook it. And if you really want the full effect of it, add some garlic juice to it. You can buy garlic juice.
Mm.
That's fairly available. You can buy garlic juice and just add some garlic juice to it.
All right. Well, any other suggestions? Any other tips?
No,
Let's
as Fuhrman says, that's the O in the G bombs. Onions and garlic are part of the allium family. So you also have shallots, you also have leeks, you also have the green onions. All of these are very healthy foods. So you just add onions to your diet and get your peppermint.
Get your peppermints and take a shower. Well, you should be doing this anyway, and you should be brushing your teeth at least twice a day, if not 3 times a day. And as always consult your doctors, especially as we said at the top, if you are going to have a surgery. Yeah, what we already mentioned it with garlic. Try not to consume it 7 days
Yeah, I
prior,
have to wait 7 days before you have surgery.
'cause I guess it's that powerful with the
Yeah,
antibiotic.
don't eat it for 7 days prior to surgery.
All right, y'all. So this is the Brewer Report, live and in person. Well, not really live, but pre-recorded and in person. Thank you so much for joining us, and we'll catch you next week. But we won't be together next week. But you'll still get that information. All right, peace, y'all.